Contact tracing for the university has definitely been an interesting experience.
A lot of people were thankful and very happy that I was following up and checking up on their symptoms. And then I also had a lot of people who were angry.
Sometimes it feels like I'm just talking to myself. People might not listen to me, and that's just frustrating.
In reality, everything we do is confidential, and we're just trying to get as much information about COVID as we can.
There are so many differences between every case that you receive, so you just have to go off what you know with that case.
I was really excited to start. However, I was pretty nervous. I felt like a lot of pent-up anxiety about what I would be doing, especially since it was so important to people. And I'm also acutely aware that this pandemic is no joke, since I also have pre-existing conditions that would make having COVID very dangerous for me.
Having to explain the science to some of these people is where it gets difficult, because there is a lot of uncertainty about coronavirus.
But there was a lot of people who just didn't quite understand how COVID works, how quarantining works, how kind of disease spreads.
Contact tracing, even though it's a temporary job, I would say is ideal for me. I really love helping community members. I'm very interested in epidemiology and the social and societal aspect of illness and healthcare.
You know, people are happy that someone's following up with them because sometimes they don't have a support system, and so being that person they get to talk to while they're holed up in their room or in their house is just very relieving, especially with all the stigma and fear that comes with COVID, and especially when you are diagnosed with it.
You kind of get to see how effective interventions actually are in terms of what the population is that you're dealing with. So definitely a very good learning experience coming out of this.
Overall, a rewarding experience, I think.